Do a little laser touch-up today, and when we do treatment for acne or scarring, I always tell patients that they may need a touch-up procedure. Now, I don't do subunits. You can't treat somebody's upper lip or their lip and chin or their nasolabial folds and not treat the rest of their face if you're doing aggressive laser, because they'll have a different color and a different texture. And all the time I see people come in here that have had that done elsewhere, and they're hypopigmented in one area and normal in another. You may be able to get away with that with fractional resurfacing, but I'm not a big fractional guy. I don't think it does that much. And why do something 5 times when you can do it 1 time? We'll have a longer recovery. So what we're going to do on this particular patient is touch up some areas of acne scarring and 1 eyelid incision that didn't heal as gracefully. And we'll show you how we do that. What we're going to do here is re-laser this area. I'm on 80 millijoules and a density of 6. You always want to keep the laser away from an oxygen source, because that will ignite if you burn that tube. And normally we're using a very high volume suction. However, it's so noisy, we're just using a small suction for the video, so there's a little bit more plume than usual. And then we'll do the same thing, and I'll come back and do another pass on that after it cools down. And you can see these little areas here are from overlap. And you have to be careful. She'll be fine, because this is, she has thick skin from acne, but there's no overlap here. But when you see dark areas, you are overlapping. Now I'm going to change the power, and we're going to drop this to 60 millijoules, density of 6. And this is just kind of a finishing pass. And this will blend in any areas that I have either missed, and as a second pass it'll go deeper and it'll homogenize the treatment area. And you can see when you do a second pass, you sometimes do get some char. All right, now what we're going to do is we're going to do a single pass on the upper lid, just for the blepharoplasty scar. And I'll follow that up with a second pass, actually. And that little bit of laser will really make a big difference on the scar. So this is how we would treat a touch-up. We've already done a full face laser, so the patient has a homogenized skin tone, and now we'll go back with these little second passes here without changing her skin tone or texture. So we're going to do some central silicone injection, and we're going to do sort of a little kind of a micro droplet and work our way up to the top. Silicone is pretty flammable, so we do the laser first, although when it's in the dermis it won't flame up. But if you're to put silicone on a tongue blade or on the skin and laser it, it'll definitely make an impressive flame. And this is our kind of combination therapy. These scars aren't big enough to perform subcision on, and we've been treating them with filler and laser for some time, and I think this is starting to round out pretty nicely now. And so I'm putting little pulsations of silicone in the different tissue planes under the dermis. It's not an intradermal filler, and you just don't want to inject a big puddle of silicone. So we're on our way to improving these lesions. I'm Dr. Joe Nyam to cosmeticsurgeryeducation.com.